Welcome to another episode of Tattoos and Telehealth. My name is Nicole Baldwin. I'm a family nurse practitioner specializing in healthcare law. And this is my good colleague, Kelly White. She is also a family nurse practitioner, and she specializes in functional medicine, hormone therapy, lots of good things. So we are back today, and today we just want to talk to you about how to find a telehealth provider, what to look out for, what to really know before selecting a telehealth provider. Just as a reminder, our lawyer makes us say this video is not constitute a patient-provider relationship, nor is it medical advice, just two gals having a chat and letting you in on it. So go ahead, Kelly, talk to us about HIPAA and about the importance and how it carries over to telemedicine as well. I mean, we have an obligation to patients to maintain HIPAA compliance, whether it's in person or whether it's telehealth. So tell us about that.
Yeah, absolutely. So I think everybody that's ever seen a provider, gone to a doctor's office, all of us that work in medicine, so if there's any providers that are watching, we've all heard HIPAA a million times. I mean, I don't know about you, but everywhere we go, HIPAA is beat into us. We have to take HIPAA training multiple times. It's everywhere you go. So HIPAA, for those that don't know, stands for Health Insurance Portability and Accountability Act. And basically, it's just a big, huge label that means it's the protection of your private health information. So your personal health information, your PHI, it is the law that protects that information. So what that means is that we as providers have to meet certain standards to protect your health information, whether that's electronically, whether that's in writing, whether that's a paper chart that we sit on our desk that we don't get to have anymore because everything's electronic now. And Nicole, I don't know about you, but back in the day when we had paper charts, I wish sometimes we could go back to the old paper chart where I could
You're
just
aging
grab it.
us. Oh, you're aging
I
us.
know. I'm like ode to the paper chart when I could just grab it. But anyway, so
Yes.
that's what it is. And so HIPAA is very important for a lot of reasons. And in telehealth, it becomes incredibly important because, like Nicole says, we don't work from home. Home is where I work. And that's important because we have a home office, and my home office has a door, and that door locks. And there is a reason that door locks because I have PHI. I have patients' private health information. And so and it's stored on my computer, and my computer has all kinds of antivirus software and hardcore stuff that I'm required by law to keep to protect that patient's health information. And so HIPAA requires us by law to have those things. That also means that we have electronic medical records that are HIPAA compliant. We do a lot of research when we first start our practices, when we go to build from everything from building our website to choosing an electronic medical record to choosing everything we do to protect our patient's health information. That electronic medical record has to have certain things in place, to the faxing software that we use, to the chat software that we use. Like in telemedicine, Nicole's going to get into this here in a little bit, the differences between sync and async, and that's just a fancy way of saying chat versus video.
Mm-hmm.
Um, your chat software has to be HIPAA compliant. It can't be the good old Apple iMessage. It
Mm-hmm.
can't be a good old chat message on an Android phone. It has to be a HIPAA compliant software that you use to chat with your patients. And so we have specific software on our phones downloaded or on the computer downloaded or whatever device we're using to talk to our patients. That's HIPAA compliant. So that there is absolutely no reason you have to be worried that seeing one of us means that your information is going to be at risk. But that's something that you need to check into. When you go to see a provider, you want to be sure you ask those questions. Make sure that you ask them, is my information safe? What HIPAA compliant things do you have in place in your office? And it's okay for you to ask them that. It's okay when you go choose a new telemedicine provider. You can ask them, what HIPAA compliant software do you have in place? What do you use for your texting features? What electronic medical record are you using? Is it HIPAA compliant? You can absolutely ask those questions because it's their job to make sure that your information is safe. And that's something that is assumed when you're in an office setting, in a brick and mortar setting. And I personally think that telemedicine is probably even safer from a HIPAA compliance standpoint because we have done so much work on our end to make sure that um, our software is embedded with HIPAA compliant information. And I don't know about you, Nicole, but I've seen hospitals' information get hacked. Nobody's going to hack my little software that has the small amount of patients. You know what I mean? Like
Yeah.
compared to a hospital facility, a hospital group has, hundreds of thousands of patients.
Yeah. Yeah, for
So
sure.
I've seen their systems get hacked and sold. And how many of us have been told that our health information got hacked? No one's going to hack mine. What do I have, right?
Yeah.
So I honestly think that it's probably safer from a telemedicine perspective, just because one, I have less to offer, and two, I don't have 10,000 people roaming around my office to look at patient information. Nobody's going to come up over my shoulder and to have a conversation with me or ask me what I want for lunch when I've got a patient's chart pulled up.
Yeah, it's very private. It's very intimate for us to sit here and to meet with the patient. There's nobody in the other room that's going to hear because of the way that our offices are built. All of that is confidential. No one's going to overhear it. No one's going to, log into the computer or see what's open or, we have to follow the guidelines. And we just want to make sure your provider has those in place. And there's nothing wrong, like Kelly says, with asking that. There's nothing wrong with asking that.
And oh my gosh, how many times in brick and mortar could you hear the conversation going on in the room next to you? And you're like,
Yeah.
oh, oh my goodness, do other patients hear what I'm saying when I'm talking to this
Yeah.
patient?
And not every patient has, hypertension or diabetes. Some patients, they want to talk about STDs, and some patients, they want to talk about their anxiety and their depression or their insomnia. And that's not something that's easy to talk about in general, let alone in a place where it can be overheard. So it's, super, super available to patients now, and it's super easy to connect. No downloadable software, nothing like that, but we do things the correct way. At least we do here, I mean, I'm sure, you just want to make sure.
And those are things that are really important when you're choosing a provider and
Yeah.
uh, making sure that you ask those questions. But that's HIPAA compliance. Also making sure, like I was saying earlier about asking those questions, if you go see a new telemedicine provider and they don't have that paperwork for you to sign, that HIPAA form that you would normally sign when you go see someone in person, and you don't have those intake forms and you don't have that stuff, to me, that would be a red flag.
Yeah, they're
That
on
would be
our website. They're on our website. Privacy policy, terms and conditions. We have to have all that legally on our website, and you can find it there.
Yep. They're on my website too. I have all of that information. My patients, sign forms whenever they come in as a new patient. And so I think that it's important for patients to understand that telemedicine is just as safe and secure. And that goes into making sure that you feel comfortable. So, that's kind of a red flag if you go see a new telemedicine provider and you don't see that information on their website.
Yep,
It should be there.
absolutely. Absolutely. And another thing I want to touch on is there's so many scams and trickery out there. And that's why really we're doing this, because we want to make sure that you as the patients can protect yourselves and your credit card information and your data from what's the truth out there and what is a scam, because scammers can be pretty smart, right? Um, but something that I want you to know about beyond HIPAA is specifically what you're looking for from a telehealth provider. Are you looking for someone to be available just when you need them? Or are you looking for a subscription service? Those are two things that before you enter in your credit card information, you need to know that. Is it going to be a reoccurring charge? And if that's what you're looking for, that's fine. If you're connecting with a provider often, that may be best. For me, I don't do subscription services. I don't personally like subscriptions, so I just don't do them. I do a fee for service. So those are two different ways that you can pay for your telehealth. And a lot of times your FSA can be used to pay for your services. In some telehealth companies, they will take insurance. Some don't. Like, it's easier if you don't. So like Kelly and I, we don't take insurance. Do you take insurance? You don't, right? Self-pay. So I do a fee for service, meaning call me when you need me. If you need me today because you have a cold or, you have COVID or need a refill on your birth control or whatever the case may be, that's, we're going to pay for that consultation. but you're not going to pay for me during a month that you don't need me. Like, just let me know when you need me. Um, and that's why I like the fee for service, because I feel like it's more transparent. I feel like I've been in a position, I grew up very poor. So I've been in a position where that subscription will put me in the negative. And I'm not afraid to say that. It is what it is. But because I don't like subscriptions, and maybe that's why, um, because I've been there in that situation. But I feel like there's so many subscriptions now. We have a subscription to Netflix, we have a subscription to Hulu, we have a subscription to, whatever, automatic withdrawal. I just don't need one more. And so that's where I'm at as far as fee for service or subscription. I want you to call me if you need me. Now, if you need me twice in a month, then of course you're going to have two consult fees, depending. If I see you one time and you need 4 medications refilled, that's just one consult. But if it's like weeks apart, then that's where it would probably accrue another fee. Now, I'm also very, very reasonable. If somebody comes to me and they have COVID, and I send them an inhaler and I send them Paxlovid after I screen them for safety. A couple days later, they come back and say, "Look, I'm really nauseous." I'm not going to charge them again. It's a provider discretion, but I'm not a bean counter, and I'm not just in it to just take your money. So for me, I have to sleep at night, right? Kelly has to sleep at night. So I want to always do right by the patient. And we can't sell the farm, but at the same time, I feel like I want to be treated, I would want to be treated the same way. And so, we definitely have provider discretion, and that's what having our own practice is about, right? It's about having provider discretion on what we are willing and not willing to do, and bend on those things. And, if it's been a few days since I've seen you and, oh, I forgot this, am I going to charge you for it? No, probably not, but fee for service versus subscription is something that you really want to know before you sign up for anything. Is that charge going to be reoccurring? And be mindful that if you pick your medication up from a local pharmacy, that's completely separate. The same as when you go to your in-person provider and they write you a script and you take it to the pharmacy, that is a separate transaction. So the consultation does not include the medication unless it's getting shipped to your home or whatever the case may be. Sometimes they'll do provider billing. But if it's going to a local pharmacy, that's a completely separate charge. There's no difference when you see me, Kelly, or an in-person provider. When you go to the pharmacy, that's between your insurance and the pharmacy. So we are just the providers, prescribers, but not necessarily involved in the medication unless it's compounded or some other whatever. It's all inclusive. Some medicines are. Kelly, you wanted to touch on reputable. How does the patient make sure that they're picking something that's reputable and it's not a scam, or it's not something that's going to be fly by night?
So whenever you are taking a look at telemedicine providers, and there's a ton of them out there, there are lots of telemedicine providers that have popped up. Pre-COVID, it wasn't quite as flooded as it is now. COVID really made it a thing, and people jumped in with both feet. And a lot of them did it for all the right reasons. But as time has gone on, people have really jumped on the bandwagon of fads, and weight loss medication became a fad, and peptides became a fad, and hormone therapy became a fad. Like, there's a lot of people that just kind of jump in there, and I'm not knocking anybody or throwing shade in anyone's direction, but a lot of people just do it to see, they're like Nicole mentioned, they're the bean counters. They just want to see, how much money can I make? How many tickets can I close? How many patients can I see? How many check boxes can I do? And they are literally running through patients just as fast as they can. And so when you go out there and you want to choose a provider, there's a few things that I want you to keep in mind. One is that the HIPAA thing, that's incredibly important. When you pull up their website, if you don't see the appropriate, privacy policies and HIPAA compliance information, you don't see those things, those are red flags. If you can't see that there are a listing in some way, form, or fashion of an about us, or a listing of providers' names or faces of real providers that you could go and take a look at their medical board or their board of nurse examiners. Like Nicole and I register with the board of nurse examiners in the states that we're licensed in. Doctors register with that state's medical board. We have registration numbers. Like if you can't go find a provider on that website and look up their information, they may not be reputable. I personally, on my website, my bio about me, it links you to my CV and you can take a look at everything that I've done. Nicole, when you click on hers, it has information about her. So just be really thorough in doing your due diligence about the company or the provider that you're going to see. Be open-minded about what you want. Be very clear about what you're looking for. If you want to see a company that has a lot of providers and you know that it's just going to be an in and out, you just want to see somebody to get your weight loss medications, or you just want to see somebody to refill your peptides and you want to get in and out quickly, and that's your thing and that's what you want, that's fine. Be honest with yourself that that's the type of visit you're going to receive. And you know that that's how it's going to be. It's probably going to be a subscription model like Nicole was talking about. It's going to be a revolving charge. And that's okay. There's nothing wrong with that. Just know that that's the service that you're signing up for. If you want a personable one-on-one, I want someone like Nicole to see me once a month. I want to sit down with her, research her website, be sure that those are the type of services that she provides. Take a look and make sure that she offers what you're looking for. Is it a video visit? Is it a chat visit? Is it a phone visit? Can I ask her for something other than that? If she says, well, your state only requires us to do chat, can you ask her for a video visit if that's what you're looking for? Is she open to suggestion? Is she open to talking with you first? Like she said, she offers a 15-minute first visit consultation to get to know her. That's incredible. That's awesome. A lot of providers don't give you the opportunity for a free consultation to get to know them. That's a get to know me, does the shoe fit kind of visit.
Yeah.
And fantastic. So picking someone who's reputable is incredibly important. Also, take a look at how long they've been in the business. Is this a brand new provider fresh out of school that just decided, I'm going to jump in and do this and I don't know anything about it? And again, no shade. Everybody starts somewhere. If you're willing to go through the growing pains of a new practice with them, that's wonderful. Just understand that that's a new provider. There's going to be growing pains. They're going to be figuring things out too. And if you're willing to ride the wave with them, that's fantastic. Just know that they're going to be learning as they go as well. But if you're at a point in your illness or your care that you're just kind of not about that, that's really not okay. You want someone who's been doing this a long time and you just don't have time for that, then be willing to acknowledge that as well and look for someone that's been in the business a while. So those things are all very, very important. Look for someone who you know has malpractice insurance. It's okay to ask them if they have malpractice insurance. Look for someone who takes the type of payment that you're willing to provide. Do they accept insurance? Do they not accept insurance? How do they take payment? Are you comfortable with that type of payment? So there's a lot of things that you can consider. Some of us, like, Nicole and I don't take insurance. How do we take payment? Do we take credit cards? Do we do Venmo, PayPal, Cash App? And are you comfortable providing that type of payment? So sometimes it comes down to a matter of comfort and what you're willing to do via this platform. So
Yeah.
Nicole, can you think of anything else from a reputable standpoint that you would toss in there?
No, I think you nailed it all. I think just knowing what you're getting into is fine. I just started doing those free, just schedule with me. I don't even ask you for your credit card information. I'll just spend time with you because it is important for patients to get to know their provider. It's important for you to feel comfortable. It's important for them to feel heard, for them to feel like you have the time for them. And if it's not a good fit, it's not a good fit. That's okay. I'm not everybody's cup of tea. And you know what? I am way okay with that because, it is what it is. And if I can't help you, I'm going to tell you, it's just, it's not something I deal with. But Kelly and I were a good match because we do have separate businesses and some overlaps, but it seems like what I don't do, she does. And so, it's just been a very, very good relationship. But the next thing we want to touch on is synchronous versus asynchronous. So what the heck does that mean? Synchronous means me and Kelly right now are on this video visit at the same time. We are synchronously on this video. Asynchronous means we're not synchronous. Means it can be chatting, but we don't have to be on at the same time. Some states require first visits to be synchronous and on a video. Doesn't have to be a lengthy conversation, doesn't have to be anything extravagant, but they do require that to establish a patient provider relationship. It's required by that state law. So every state has their own laws, what they like. It's not a nationwide thing. If it was, I'd only need one license for nationwide, but I have to have 50.
That'd be
So,
awesome.
yeah. So some states require that. There's a couple states, only a couple out of all 50 plus DC, that require every appointment to be video visit. Most of the states say, look, if you have some sort of HIPAA compliant, asynchronous form to chat, that is sufficient as long as you provide your ID, whatever. So as long as you meet the requirements and the provider meets the requirements, they can render care asynchronously through chat, because that's the way that everybody texts, right? Everybody texts. And so that's just, it's easy. You text me, when I get a minute, I'll text you back. When you get a lunch break, you text me back, right? And so that is what's convenient, but some states do require more than that. Some require a phone call. They say audio synchronous, which means you don't have to have video. Some require audio video, but even on a phone call, that's still synchronous. You're both on at the same time. So it's synchronous, but it's not video, it's only audio. And some states just require a quick conversation, and then you can move everything to chat. Most states will allow you to do everything via chat. The next category, a few states want the initial video, but the rest can be chat. And very few states want to have every consultation video. Some are just phone, but I'm not going to say specific states because it changes what seems like every 5 seconds. So just know the majority, it can be chat, but at any time, you should be able to say, can I have a video visit with my provider? And they should be able to provide that. I have a lot of asynchronous patients, but they know that they can schedule an appointment to be with me, and I will show up every time because I want them to see my face. I want them to feel like I am a real human. I'm a real human. Like, I'm here caring for you. And I do have a team. I have a couple ICU nurses. I have some pharmacy staff that just handle different things. I don't have a pharmacy. I don't own a pharmacy or have any whatever with a pharmacy, but I have pharmacy staff because that's what they deal with, prior authorizations and things like that. And so I have a team, but I'm on every day. I'm truly on every day. And video visit or asynchronous, if you're in a video visit state, whether it's me or Kelly, we will tell you, schedule a video visit before care is rendered. It's required. It's not because we said, it's because our lawyer says. So we just do what we're told. So if your state requires it, it is what it is. So there's just no way around that. And so you want to make sure that you're in compliant with your state laws, and your provider will let you know. They should anyway.
And sometimes we may jump in and say, I feel like this is a little complicated, or maybe we're not jiving via text. Let's jump on a video real quick so we can be sure that we're understanding each other.
Yeah.
And that's okay too. And that's also the beauty of telemedicine is, obviously, just like in any text, we can't read each other's tone in text.
Right.
We have to assume a lot of things in text message. So if you feel like you and your provider aren't jiving, just real quick say, hey, can we just jump on a call? Like, I feel like you're not understanding me. And that's okay, guys. We do not get upset about that. I don't get upset about that. I'm like, you know what? You're right. I'm not understanding you. Let's jump on a call, or let's jump on a video. And that's totally fine. We are so used to the inconveniences that can sometimes come about when you're trying to imply a tone in a text message. So we get it. And there is zero wrong with that. Like Nicole said, we will always be there. We will always convert that to a phone call, or convert that, flip you a link to a video and say, you're right. Let's jump on a video real quick.
Yeah, sometimes it's just that fluid conversation is needed. There's so much going on. I have this, but I have this, but I have this, but wait, here's what I've already done. And sometimes just that fluid conversation is so much easier. Let me have a 5-minute fluid conversation versus clarification of a bunch of things on text. So there's definitely value in flipping to a video. Or if you have a rash, I may want to see it. If it's not a typical, glaringly obvious what it is, and because you've sent me pictures, I may want to see it live, so to speak. Let me see more of where it's at. And so sometimes I'll say pictures are great, and most of the time they're good, but sometimes I just want to see it. I want to see if you're if you have pink eye, I don't always have to see it, but sometimes I'm like, all right, let me just get a really good look at that. And so we'll flip it to video, but it doesn't happen often, but especially if the patient wants it. Absolutely. Anytime, anytime. And so Kelly, with your practice, can the patients expect to see you every time?
Absolutely. Absolutely. So the other thing about choosing your telehealth provider is whether or not you're going to see me every time, Nicole every time, or if there's multiple providers. I get asked quite often, well, will I see you every time? Or is there going to be someone that jumps on like random people? No, when you come see me at Kari Health, you will see me every time. It will just be me. Like Nicole said, I have people that I kick things to take care of for me, but it is never another provider. It will always just be me. Nicole's mentioned that she has a team of people in her background to help out with things, but it is always going to be her that you see as a provider.
Yep.
Now, that is not always the case with other telemedicine, telehealth platforms.
And that's okay.
That's okay. There's nothing wrong with that. But there are other, and I call them platforms for a reason because they are a platform with multiple providers that staff the platform. So when you go in and schedule, they may have 10 providers that cover the state you live in. So when you schedule, you're scheduling with a provider that's on shift at that date and time in the state that you live in. So you may not always see the same provider. So be sure that when you're researching a provider or a telehealth company, especially if it's a big platform like that, that you pay attention to whether or not it's a multiple provider platform or a single provider company like myself or Nicole. And that's important to know as well. So when you come see me, it's always going to be me, Kari Health. When you go to Nicole's business, which is Hamilton Health, right?
Hamilton Health and Wellness. Yep. HamiltonTelehealth.com.
You will always see Nicole. And that's important as well. I personally want to see the same person when I go see somebody because then I know that there's a good continuity of care. They know me, they remember me. We can discuss, things from time to time to time, and I don't feel like I'm repeating myself. Some people are okay with seeing a different provider, and that's fine too. There's absolutely nothing wrong with that. Sometimes it's just a matter of it makes it more convenient. You have more opportunities to schedule at your date and time. There's more slot options when there's other providers available to see you than it might be if I'm busy at that date and time or I have another patient scheduled. Sometimes it becomes a little cumbersome, but either way, just be sure that you're paying attention to whether or not where you're going, it's the same provider or multiple.
Yeah, that's very, very true. Just know what you're getting into. There's nothing wrong with subscription. There's nothing wrong with fee for service. There's nothing wrong with seeing the same provider. There's nothing wrong with the group. There's benefits. There's pros and cons to all of it. There's pros and cons to asynchronous. There's pros and cons to synchronous. But just know what you're getting into. Just really just pay attention. And I think there's so many options out there that it is hard to say, well, what are my other options? And so we just want to make sure we give that to you. So we appreciate you joining us today. You can find me and all of the services that I provide at HamiltonTelehealth.com. And you can find Miss Kelly here at
KariHealth.com.
And that's CHARI
Yes.
.com. And if you have any questions, just let us know. I also have on my website, I have a HIPAA compliant text line. Feel free to text me, schedule a visit. Yeah, just let us know. Visit our websites and there is information on how to reach us both. And we hope you guys have a good day and we'll see you next time.
Bye, guys.